I'm pleased to be joined today on Health Beat by Dr. Alex Laudenklos, an obstetrician and gynecologist with Faith Regional Physician Services, OBGYN in Norfolk. And today, we're discussing cervical cancer screenings. Dr. Laudenklos, talk about the importance of a cervical cancer screening.
Thanks, Rob. So cervical cancer, with the aid of screening over the last decade or two, has really decreased in its incidence and how much of it we actually see. So it's really a key important screening test, and it's relatively cheap, and it's relatively easy to perform with very little discomfort or adverse effects to a patient for a cervical screen with a pap smear. So really it's become the front runner of one of our cancer prevention tests for women, as well as the HPV vaccine. So cervical cancer screening consists of a pap smear, usually in the majority of women starting at the age of 21, other than certain select populations of patients, immunocompromised or HIV patients as well, where we obtain cervical cells. They get put into a container and sent to the lab. The lab puts them on a slide. They examine them under a microscope and look for any abnormalities. With these abnormalities, they're also looking for what we call HPV changes, the big push for HPV now, vaccines anyway. And if any of those changes are detected, then they get sent back to us in a report, and then we call the patient back for either another pap smear in a year, 6 months, or colposcopy or examination of the cervix under a specialized sort of microscope that we have in the office there. So it's really a great way for us to detect precancerous lesions before they become cancerous, and then to really examine the entire cervix and potentially do a diagnostic, meaning we evaluate it more thoroughly with bigger tissue samples, and sometimes, a lot of times actually, that can be therapeutic.
To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.